Good afternoon, everybody. I'd like to welcome you all to the podcast on the coronavirus vaccination programme in the Borough of Richmond. We are due to have quite a lot more participants join us, but as this was scheduled to start at 3:30, I think we'll get going and people can catch up with us. I'm Julie Risley. I'm a trustee at Healthwatch Richmond, and I chair the committee that oversees our projects in health and social care. This podcast is a joint Healthwatch Clinical Commissioning Group and Richmond Council event. And I'd like to introduce you to our panel of members. Can I start with Tonia Michaelides, please?
Hello, I'm Tonia Michaelides. I'm the Locality Executive Director for Kingston, Richmond as part of South West London Clinical Commissioning Group. I'm also leading the vaccine programme for South West London.
Thank you. Patrick?
Good afternoon. I'm Dr. Patrick Gibson. I'm the GP Clinical Lead for Richmond Borough as part of South West London CCG, and thank you for inviting me to speak today.
Thank you, Patrick. Shannon? You've got some background noise. I'm not sure where it's coming from.
Hello, I'm Shannon, Katiyo. I'm the Director of Public Health for both the London Boroughs of Richmond and Wandsworth. And thank you for inviting me today.
Thank you, Shannon. And Mike?
Good afternoon. My name is Mike Derry. I'm the Chief Officer of Healthwatch Richmond. We review NHS and social care services and help people to find answers to any of the questions that they might have about those. And we've brought this event together today.
Thank you all. We're going to start with two short presentations setting the scene for the impact of COVID-19 in the Borough of Richmond, and then a lot more detail about the vaccination programme, followed by a question and answer session where we'll be putting the questions that you've raised with us to the panel members. I'd like to start the presentations with Dr. Shannon Katiyo, the Director of Public Health for Richmond.
Thank you. So good afternoon again, everyone. I'll just issue a slight correction. I'm actually not a doctor, even though I am a Director of Public Health for the boroughs of Richmond and Wandsworth. I thought it would be helpful to just set the context in terms of why the vaccine is so important and just to understand the local picture, as well as why the delivery of the vaccine to particular groups and the prioritization has been approached in that way. Next slide. What I have in front of you is the number of new cases that we've seen in Richmond, right from the very first case that we saw early last year to the cases that we've seen in most recent days. And what you can see is that we've got three very distinct peaks of coronavirus that we've had. Now, even though in the first peak of the pandemic last April, not everyone was being tested, what we've seen in the successive months is that we've had significantly more people being tested positive with coronavirus, and actually the figures really way out there in comparison to what we've seen previously. Now, fortunately, the numbers are on the way down, but actually they're nowhere near the levels that we saw at any other point in the pandemic, and I think we've still got a long way to go in terms of the effort. Next slide. Now, on this slide, I present to you two different charts, and one is for people aged from 0 to 59, and the other one is for people over the age of 60 years. Now, we know that people aged over 60 are at increasing risk of severe illness from COVID, and also that the chances of dying increases considerably with age, and that's one of the biggest risk factors for ending up in hospital with severe illness or dying. So even though we've got more people in Richmond between the ages of 0 to 59 who've been diagnosed with the virus, we can also see that we've still got a high rate of people with infection over the age of 60, and that is a particular concern if you think about the impact on the population in terms of admissions into hospital and also the risk of dying. So again, I think it's just to emphasize that We're particularly concerned about people over the age of 60 and the elderly population, as well as some of those people who might have other additional illnesses that will increase their risk of having a poor outcome. Next slide. On this chart, again, it's just to emphasize the same point. What I present here is the number of hospital of patients in hospital at Chelsea and Westminster, which includes West Middlesex Hospital, and also in Kingston. And this is a 7-day average of those number of people who are currently in hospital. So the take-home point is to note that even though we had quite a severe situation in terms of hospital admissions and deaths in the first peak and the first part of the pandemic, we're seeing increasingly more people being admitted into hospital than we did in that first wave of the pandemic. And again, we're only just starting to get a sense that those hospital admissions have reached a peak and that they're stabilizing. But the vaccine is so important right now in terms of helping us to reduce those rates of hospitalizations and potentially deaths. Next slide. Now on this slide, it shows the unfortunate deaths that we've seen, and these are of Richmond residents. Now we know that 89% of those people in hospital with COVID who died were aged over 60, and that the chances of someone dying or becoming significantly unwell increases with age. In the first phase of the pandemic, you can see that every week we unfortunately did have quite a high number of deaths, and sometimes more than 30 deaths were being experienced on a weekly period in Richmond alone. And then actually in the summer months, late summer and going into the autumn, we were fortunate enough to see those deaths actually stop. No COVID-related deaths happening between the months of September and November. However, in this phase of the pandemic, we've gradually seen those numbers of deaths rising again to levels where we really wouldn't want them to be. And, you know, even a single death resulting from COVID is regrettable. Now, unfortunately, it will take some time before the number of deaths starts to stabilize. So even if we're seeing this reduction in the number of cases of COVID being diagnosed and potentially a stabilizing picture within our hospitals, we can expect that the number of deaths that are sadly occurring may continue to rise for a time. And again, that's why this vaccine is absolutely important for people who are at increased risk of becoming well or dying. Next slide. Thank you. So that brings me to the end of my sort of public health update, and I'll hand over to Tonia Michaelides.
Thanks very much, Shannon. Tonia, you're ready.
Thank you, Shannon, and thank you, Julie. And I'd like to begin by thanking the population of Richmond, who have come forward in a very positive manner to receive the vaccine. And I have to remind myself that we've actually only been delivering the vaccine for nearly 2 months now. We've done a fantastic job in Richmond. So I'd also like to thank all the staff who have stepped up and delivered the vaccine, and everyone who has supported the NHS to date to do that. Lots more to do, but a real positive position that we're in Richmond. So as I said, I would give you a bit of an overview about how we're delivering the vaccine. So where are we delivering the vaccine? So there are 3 main areas where we're delivering the vaccine. Large vaccination centres, which are high volume, high throughput in a fixed location for an extended period. And this week we are opening the Richmond Vaccination Centre, which is based at the Harlequins in Twickenham. We also have local vaccination services that are run by our GPs coming together in groups, and they are leading a number of sites across Richmond. They also provide the roving home, the roving model, which is for the housebound and people who have been advised to stay at home and shield due to their clinical condition. And they also are focused on delivering the vaccine to our care home residents and staff. And then the final, less utilised site for the population of Richmond is our hospital hubs. So all the hospital sites in southwest London, including Kingston Hospital and Teddington Memorial Hospital, are offering vaccines mainly to health and care workers, but also to some patients. So next slide, please. I think it's really important to remind people that we are doing offering the vaccine in a priority cohort order, and actually the priority groups are set nationally by the Joint Committee on Vaccination and Immunisation, known as JVAC, and they are the people that advise the government on the priority cohort. So the cohorts aren't set by the NHS, they are set by this committee and endorsed by the government. And the first phase, we're calling this phase, phase 1A of the vaccine programme, is concentrated on vaccinating the first 4 priority cohorts as identified by the committee. And here you can see them written down, but just to go through them, the first cohort is care home residents and staff working in care homes. I'm really pleased to say that we accessed all our care homes in Richmond by the 24th of January and had over 80% of our residents managed to have their first dose. We are also vaccinating staff, both in the care homes, but also at other sites such as the hospital hub sites, and we will continue to work on that. And our goal is to meet the Prime Minister's pledge by the 15th of February that we would have vaccinated these 4 cohorts. So the second cohort is people aged 80 or over and frontline health and social care staff. Third is people aged 75 to 79, and the 4th cohort is people aged 70 to 74 and the clinically extremely vulnerable. And the clinically extremely vulnerable people are those people generally who have been advised to shield and received a letter with that advice. As I say, we've done very well in Richmond, and by the end of this week, we would have vaccinated most of those people in that cohort. So that's fantastic news. Next slide, please. So, as I said, our update on progress, all South West London care home staff and residents have been offered the vaccine. Well, actually, it's higher than that now. In South West London, we have now delivered 197,000 vaccines, which is one of the highest figures in London. But the data is published on the NHS website every Thursday afternoon for you to have a look, and we are working on sharing borough level data as soon as it is available. And then the next slide, please. So I just want to reiterate that thank you message. It's really important, not only that we, our staff work so hard, but actually our population coming forward. And I hope from this event, we'll be able to encourage even more people to come forward and have their vaccine. Thank you, Julie.
Thank you very much, Tonia, and thank you both for very interesting and clear slides. Shall we move to the first question? Might I ask the first question? You've given us some very useful background information about when we get the vaccine, what the tiers are. How will people be sure that they're in the right tier and they're not being overlooked? And what for this, the contact comes via your general practice, but what if you're not registered with a Richmond GP?
Shall I start, Julie, and then Patrick might want to add. So what we're saying to people is we have our list of people, we're moving through them. The Prime Minister's promise was that everyone in the first 4 cohorts would be offered their first vaccine by the 15th of February. I think I would ask people to be patient. If they haven't heard by the end of next week, I think, and they feel they are in those top 4 cohorts, I would recommend contacting your GP to talk that through. In terms of being contacted, I think there are several ways that you can be contacted. Some people will receive a letter, and they're from the National Booking Service, and that is through for booking onto the vaccination centres. GPs will contact you mainly by telephone and text, occasionally by letter, but also if they have notes around how you'd like to be contacted, they will contact you in that way.
Thank you. Mike, I know there are people trying to put their hands up to ask questions. Would you like just to explain to people what they do if they want to raise any issues during this event?
Yes, absolutely. Thanks, Julie. So we had a huge number of people registered to attend the event, which is fantastic to see. But unfortunately, what that means is that with a reasonably small staff team, we're not able to respond live to all of the questions that people might have. So what we've done is we've got an email address which is in the chat that you should all be able to see, where two members of my team, Sarah and Julia, will be picking up any emails that you'd like to send with any questions that you have as the event goes through. We'll try and respond to them all live, but obviously there may be more questions than we have time for, so we'll certainly work our way through any questions that you have. I think it's probably worth noting this isn't the end of the conversation. It's not the beginning of the conversation. This is one point where we're able to answer the aggregated questions of everybody that's submitted a question for this event. So we'll try and cover as many questions as we possibly can in the time that we have. But certainly you can keep sending your questions to Healthwatch Richmond, and you can also call us on our phone number, which I'll share with you at the end. So thank you, Julie.
Thanks. Do you want to pick up the next question, Mike?
Yeah, absolutely. So for a large number of people, there were. Oh, sorry, Patrick, please go ahead.
Yeah, thanks, Mike. So just going back over that first question. So registration with the GP obviously is important. If you don't want to be permanently registered with a practice, though, you don't have to have a permanent registration. You can make a temporary registration at a practice. You also may perhaps be registered with a private GP. And again, a lot of the private clinics are making arrangements with their neighbouring primary care network vaccination sites to make sure those patients are picked up. So the key message is really to get yourself registered so that you can then be contacted. Thank you.
Thanks, Patrick. And I mean, that's certainly something we've heard some things about from the community. And presumably, if anybody's trying to register temporarily with a GP and unable to for the purposes of getting a vaccine, can they come through to the CCG to ask for support with that?
Certainly, yeah. And the other groups we are also reaching out to some of the harder groups to deal with from this respect, so asylum seekers, homeless, and there are plans in place to try and support those groups as well.
Brilliant, thanks, Patrick. Okay then, so moving on, if we're okay. A large number of people had questions about how the process works for getting their first dose of the vaccine. How will they be contacted? How will they know that it's a genuine contact? You can tell us a bit about what it would be like as a patient to go through that.
Again, shall I start? And Patrick may want to add. So I think it's really important the message is that the NHS will contact you when it's your time. So I know that it's really people are very keen to have the vaccine and want to access it. And I know I have elderly parents myself who both have had the vaccine, and we talk to our friends and we talk to our relatives and we say, oh, this person has the vaccine and I haven't had the vaccine. I just ask for some patience, and I say everyone will be contacted if they're registered with their GP and they are in the 1 to 4 cohorts by the middle of February. As I say, there are various ways you can be contacted, and it is still a process that we're trying to streamline and improve on. But there is the letter, and that's a nationally generated letter for invites to the booking to the vaccination centres. As I explained, the Harlequins will be opening up soon. Also, your GP will contact you, probably most usually by telephone. They may also text you. They may also write to you. And I say, if there is a note in your records about how your preferred way to be contacted, that's what they will use. So I think I'll keep a lookout for those that telephone call or that text or that letter. And if you're in doubt, though, ring your surgery just in case if you would just want to ask, have you contacted me? I wasn't quite sure. I don't recognise this number.
Thanks. And a couple more questions have come up around that about why are some people seeing friends and neighbours who are younger than them being invited for vaccines when perhaps they're slightly older and haven't been invited?
So I think a lot of it depends on where you live, and as I said, the groups of GPs have come together to deliver the vaccine, and sometimes the population profile is different for each of those groupings. So some people have far more over 80s than others. So sticking to the priority cohort and being able to go through in an orderly fashion has been the ask. So in some areas they've been able to go through that quicker because they have less over 80s. I think for me, I would hold on to the fact that everyone over the age of 70 will be offered the vaccine by the 15th of February. And it will just depend really on how that process is working for your local area. So although I know it can be quite frustrating when you see people who are younger coming first, it's just a process. We have huge numbers of people that we are looking to vaccinate in Southwest London, over 200,000 people. So it does, there is only a certain number of vaccines we can deliver at any one time. So that's why sometimes it feels a bit slow and a bit clunky, but we will get there, and everyone will get their vaccine by the offer of their vaccine by the 15th of February.
It's also perhaps likely we'll see less of that from now. So as Tonia said at the start, this has only been running for a short time, and as is often the way, there are some sites that are keen to get going absolutely from the start and want to be in the vanguard of it. So there are 6 primary care network vaccination sites in Richmond that started up, and there was a staggered approach to that because some of them wanted to make absolutely sure they were confident in what they were doing, whereas others were in wave 1. So inevitably, therefore, you'll get a little bit of variation on that. What's happening now, though, is because nationally they have set this very clear guidance about the 15th of February to have all 4 cohorts done. The supply of vaccine will be managed to make sure that there is uniformity across the patch within those first 4 cohorts, those being the 4 key cohorts that will need to be done before we can start to be confident that we're going to be able to reduce the hospitalisation and deaths from this disease. So we will probably see that variation ironing out.
So the message is kind of keep the faith, really, and presumably people who haven't heard by the 15th should be thinking about contacting their doctors and ensuring that that they do get that vaccine if they are in those first 4 groups.
And if you know that we reached the 15th of February and you haven't been contacted within your cohort, then definitely contact at that point.
Perfect, thank you. The last question here is one that's come up, I think, increasingly as we got towards the event, which is about the vaccination cards. A number of people calling in saying, I didn't get one. Other people have had them, but they weren't giving them out. What's going on there? Are they important? Should people be making a point of trying to get them, or is it just not as important as it seems?
So we don't have a proof of vaccination card as such. I think what people were seeing was an appointment card that was being adapted because we have the government haven't talked about having that proof of concept of a proof of vaccination yet. I think it could come, but at the moment, because we haven't finished the vaccine programme, because we haven't done all 2 doses yet, and also it's really important that we continue with the social distancing, the lockdown approaches, that we haven't got a card that is proof of vaccine or a card that then gives people some kinds of freedom to be able to act because it's a proof of vaccine. So we don't have a card as such, but I think it might have been an appointment card that people saw.
Yes, I think that's right. So the PCN sites had the option of using those appointment cards, but they were never designed as a legal certificate of vaccination, which I think is what the public actually want going forwards. The cards also were designed to try and help with second appointments, but obviously it became apparent quite quickly that there was a change in policy on second appointments, so they became even less useful in that context. The other thing about the cards, obviously, is it takes an amount of time with each patient to complete those cards, which delays the process and keeps the patient in the vaccination site for longer. And the objective in terms of minimising risk of infection is to minimise the duration of contact. So anything that expands that time increases the risk of the individual patient. So the understanding is that there will be an online vaccination certification system at some point in the future.
Thanks. Shall we move on to the questions about the second dose, Mike?
Yeah, thank you. I think that's a great segue because I think there's been a lot of questions that have come up both through this event and elsewhere. Have we lost Tonia? Tonia, if we've lost you, thank you. You're back.
No, sorry, it's because Patrick's going to answer these ones.
That's all right. Okay, so there've been a lot of questions about the second dose. Obviously, there was a bit of a shift from the original policy, and I think people are keen to understand: will they get a second dose? Is that guaranteed? Will it be the same brand of vaccination? Will it be a different manufacturer's vaccine? But also, similarly to that first question, how would it be arranged? How will people know when they're due to be offered their second dose? And at what point should people start worrying about that and chasing it up?
Thanks. So, I mean, it is unsettling, isn't it, when policy changes? But to put this into context, so the Pfizer product extended out its trial so that patients moved right the way through to, the AstraZeneca product extended its trials out so that people had vaccinations right the way through to 12 weeks. And what they discovered is that patients who had their second vaccine between 8 and 12 weeks had greater protection than patients who had their second vaccination at 3 or 4 weeks. Pfizer, unfortunately, when they did their trials, didn't extend out the intervals between their first and second jabs. So they only had data through to 3-4 weeks. Now, the challenge then arose because the prevalence with the new variant meant that the pressure in the hospital sector on intensive care became such that it was critical to try to get as many people vaccinated with the first dose, because most of the protection from the vaccine arises from the first dose. Historically, booster doses of vaccines are more important in terms of prolonging the duration of protection rather than the initial protection. So the Joint Committee of Vaccination and Immunisation, which is the group that sits and reports to the Minister, looked at it, and their scientists and their doctors within that looked at the data around other vaccines that were used historically, and extrapolated from that and came to the decision that the policy of offering the second jab at 11 in the 11th, 12th week meant that the degree of protection that offered was a good approach to go to, on the basis that it meant more people will get first jabs. So that's the basis for the delay on the second jab. In terms of guarantees of supply, we are assured at the moment that we will have supplies of the same vaccine. Responsibility for giving that vaccine lies with the organisation who gave you the first. So you'll have the same product at the same site, unless there is some particular reason why that wouldn't be the case. So, for example, a small number of patients were inpatients in hospital at the time and had their first jab in hospital, and arrangements will be made for them to have it in the community later.
Thanks, Patrick. So I guess the next sort of the next chunk of questions all related to people being interested in the effectiveness of the vaccines. There were lots of questions about how do the vaccines work, what's the difference between the two vaccines. Obviously, the mRNA vaccine is a new sort of technology that people might not be quite so familiar with. But can you tell us a bit about how the vaccines work and how effective they are?
Yeah, so they're both novel. Historic vaccines have been based on using an existing virus and changing it in a way where it is less threatening to the body, and then using that as the basis for a vaccine. Whereas with the two products that we've got, they're both synthetic products. So you clearly, with a synthetic product, you can't elicit the same sort of disease profile, and that's probably why they're being tolerated as well as they are. So with the Pfizer product, it's a messenger RNA product that you inject into the body. The body actually gets rid of the messenger RNA very quickly. So the product that's been injected disappears quickly. But what it's done is it's gone into the cells, and the cells have then been programmed by the RNA to replicate the spike proteins that exist on the surface of the cell of the COVID cell. So when those cells die off, those particles are then released into the system, and the immune system recognizes those fragments of the spike protein and then mounts an immune response against those. So the AstraZeneca product works in a similar way, except that it's a DNA-based product rather than a messenger RNA product. But it's doing the same sort of thing. It's encouraging the body to make RNA, messenger RNA, so that that's genetic material, which then makes the part of the virus. So not the whole virus, but the parts of the virus which enable the body's defense system to pick it up should the body be subsequently exposed to it. So in terms of efficacy, people often wonder, people often say, oh, well, I prefer to have this vaccine than another. Yeah, from a clinician point of view, that there isn't a product that's better than another. They're both exceptional products. So the protection they offer is significantly greater than the protection that we get from the flu vaccine, which historically the range of protection we estimate with that is 40 to 60%. But the evidence with these products is that even with single vaccines, with the single dose, the protection runs at around 89% and 73% for the two products, 73% for the AstraZeneca and 89% for the Pfizer. But the key part is, and that's absolute protection against the virus. The key part of it, though, is not necessarily the totality of the protection. It's about the fact that it keeps people away from hospital because they're not getting severe disease. And even those patients who aren't picked up in the within that 11% and the 27%, even those patients are highly, highly unlikely to get severe disease and require hospitalization. So within the trials, within the Pfizer trial, there was only a single patient who'd been vaccinated who went on subsequently to get severe disease. When they looked at the vaccine failures, virtually all of the failures reported in the trials happened in the first 10 days after the first vaccine. And what that tells us actually is those patients probably incidentally caught the virus before the vaccine had a chance to work. So I'll stop there. Thank you.
Thanks, Patrick. Shannon, is there anything that you wanted to add on that? Or has Patrick covered it?
Yes, I suppose what I'd just like to reassure everybody who's in this meeting is the fact that all the three vaccines that have now been approved by the Medicines Health Regulatory Authority have all undergone the same rigorous testing in terms of their safety, their quality, their effectiveness, and all the standards that need to be achieved in terms of actually a vaccine being licensed and put out to the public have still occurred, even though it might have happened in a shorter space of time than normally, because we are in a public health crisis, and so the world has needed to come together to do things quicker and in a different way than we would have normally. I think the important thing to take home from there is that all the vaccines are highly effective, they are safe, and even after vaccines have been licensed, the monitoring of those vaccines doesn't stop at that point. What are called phase 4 trials will continue to look at what's happening with the vaccines, and if there are any issues, there's, for example, a yellow card scheme. People who are receiving the vaccine will be made aware of this, and if there are any issues, they can report those online. Thank you.
Thanks. Mike, do you want to move on to safety of the vaccines?
Yeah, absolutely. So thank you. I think a lot of people had questions about the safety of the vaccine. It's not necessarily just is the vaccine safe? Is it going to harm me? But can I take the vaccine with a particular health condition? So people with things like asthma, people who are pregnant or breastfeeding, and with the whole, I can't list all of them because we had a huge number of questions, and there were all sorts of different questions. But what can you tell us about who the vaccine's safe for and who shouldn't take it?
So as time's gone on, and we've learned a bit more about this, and advice has changed in some of those groups. So there are. This is not a live vaccine. I mentioned before about the difference between this and other vaccines. It's a synthetic product, which does not carry the risk of it isn't an active viral particle in any way. So the profile of tolerance reflects that really. So there aren't any conditions that absolutely preclude it. There are some conditions where individuals might want to talk to their individual doctor about it, but they are very, very few and far between. So when an appointment is booked, there is an opportunity at that point to discuss whether your condition has any contraindication, but there are genuinely hardly any that mean you can't. Breastfeeding, originally they suggested that the products could not be used in breastfeeding or should not be used. They've modified that advice since, and that can be used now. With pregnancy, the trials weren't done on a pregnant population, and for that reason the recommendation is that unless the risk of the pregnant lady is extremely high, then vaccination should not happen. And if there is a particular condition that does put the patient at extremely high risk of complications of COVID, that discussion should be happening with the clinician, the GP.
Thanks. Shannon, did you want to add anything to that? Or Shannon,
yes. Perhaps I'll just add that obviously further to what Patrick has just said, there might be some people who will have sort of documented history of severe allergic reaction to one of the vaccine ingredients. And obviously, as part of the process of getting the vaccine, some people might complete that questionnaire in terms of any known reactions to particular things before they attend their appointment. And also there will be a check at the point where they have the conversation before their vaccine has been administered, so that if they do have any issues that require attention, those will be brought to light. Those who haven't had an experience of actually getting the vaccine will also know that for a period of around 15 minutes after you've had the vaccine, you will have the opportunity to sit around in a waiting room, and if there's sort of any potential reactions, all the people who have been trained to deliver the vaccine have also been trained to support people who might have some form of reaction, and there will be that sort of medical support available. And actually to date, I'm not aware that there've been significant issues without putting a number on it in terms of people who've had any severe reactions.
Thank you. And that's useful to know. So some of the people who've had allergies and come to us to say, is it safe for me to take it, have had things like allergies to penicillin, to sulfur, to seafood, to sometimes some quite specific things, to medical contrasts. What do people do if they've got a concern? Clearly they speak to the clinician when they turn up to their appointment. And certainly I know that I've looked at the ingredients, and some of that stuff's quite difficult to, I was going to say difficult to digest, that's not what I mean. But it's some of it's quite difficult to understand. What's the advice for people around that?
Yeah, it's a really good point, and thanks, Shannon, for raising the hypersensitivity reactions, the anaphylaxis, the allergic reactions. The advice on this has changed as well over time. So we were much more cautious at the start because it was a relatively new product, and the range of anaphylactic reactions which meant you couldn't have this vaccine, were greater to start with. But it comes down now really to whether you've had an allergic reactions to previous vaccines, because it's the individual products within the vaccine, and they're fairly common across all vaccine groups. So that's really the sort of answer to that. But the key part is to have that discussion with the clinician who's going to be responsible for giving you the vaccine, so that there's clarity. But a straightforward reaction to penicillin historically would not now be a contraindication to, or to any other drug, would not be a contraindication to these products.
Okay, thank you. Julie, I don't know if we have time for another little probe on.
I was going to chip in and just say, it's somebody who's been tested positive with COVID. I mean, there are certain things that you're asked not to do for a while. I mean, how long after, if I've had been tested positive, how long after I've been tested do I have to wait before I can receive the vaccine?
So 4 weeks, that's reasonably straightforward.
Thanks. And there's no reason why someone who's suffering from long COVID or that sort of condition shouldn't come forward with a vaccine when they're invited.
No, there's no evidence that they're any more at risk.
Okay, thank you. Okay. So moving on then, there was, we've picked up some of this I think earlier, but a lot of people were really interested in how we're getting on with vaccinating. And I know we've covered that to some degree earlier, but yeah, when will we get to see a breakdown of those sorts of numbers about how many people have had their vaccine in Richmond, and about who those people are to some extent in terms of their their age and their ethnic background and so on?
Very soon, Mike. So, I appreciate that we wanted to spend time setting up the vaccine vaccinated rather than producing numbers. We have been collecting numbers through people's records being recorded on the clinical systems. We're working through that now. We just want to make sure it's as good as we possibly can. So we're looking to do that shortly. I'm hoping to have something, if not very this week, it will be next week.
Okay, so imminently.
Imminently.
Shannon.
Thank you. I just wanted to add that obviously from a public health perspective, any of the data on vaccine uptake is very important for us in order for us to monitor any inequalities. There are some of the usual groups that we're always concerned about in terms of their access to vaccine, and it's important that we start getting things in motion to look at how that's panning out and make sure that we've got necessary plans in place to reach those particular groups and communities to encourage uptake. Now, currently in public health, we have started to receive through our usual data flow processes some data on vaccine uptake, and initial indications are good in terms of the coverage or the uptake, particularly in our over 80 population. But as Tonia says, we are concentrating on ensuring that that data we get it right and we've got a complete picture, and I'm sure in the not too distant future we'll be able to start sharing some of that more routinely. I think just to add, the residents of Richmond will know that on a weekly basis they do get a Director of Public Health briefing on COVID from me and my team, and in there we've gradually increased the range of indicators and issues that we're addressing through that bulletin. And so at a point where we're able to share more data on the vaccines with you, we will include it in that weekly bulletin to Richmond residents. Thank you.
Okay, Mike.
I think Patrick wanted to come in here as well, if that's right.
Yeah, and echoing Tonia's comments there, we need to have corroborated evidence before we consider present it to you, and it's really important that we give you accurate information. So if you look at it the other way around though, so I know where the 6 primary care network vaccination sites are with reaching out into those first 4 cohorts, and I know that by the end of this week they think that they will have contacted everybody and offered vaccination to everybody within those first 4 cohorts. I also know that every practice has been in conversation with the community roving model team to ensure that the housebound have all had approaches and dates in the book to be done. I know where we are with our care homes. We do from time to time get another little group of people who come out of the woodwork who we were unaware of, and we're always really happy to learn about those. So there was one of our learning disability homes that is in a higher cohort than we thought it had been. So we are all the time picking up little bits like that intelligence through the community. So yeah, we're in a very, very good place locally, and it's almost going to be a pause message for us here, because in Richmond we will have hit those cohorts before some of our
heartening to hear. Yeah, thank you. That's very heartening to hear. Because
could I sort of do a follow on from that? I mean, everybody who will have been eligible will have been offered a vaccination. Some people have not yet accepted. If I've been offered but declined and I change my mind in the future, what do I do?
That's a really good point. So we've set the system up so that best practice is that all of the patients will be contacted on 3 occasions, ideally by different methods. So maybe a phone call, text message, message through the post. And they will be given 3 offers on that basis. We are trying to encourage the last contact to be from a senior clinician who knows the patient, because we know that the intelligence that the trust, really, I suppose, rather than the intelligence, the trust that exists between patients and their known senior clinicians often has quite an influence in encouraging patients to take up vaccine when they wouldn't otherwise do that. And if those 3 offers have been made, then the practices will not, or the PCNs will not actively contact the patients to offer them further appointments, because as you will appreciate, there's a logistical workload that goes into that, and there's a law of diminishing returns. But that does not mean that if the patient changes their mind, they cannot subsequently access it. So if a patient does change their mind, they are perfectly at liberty to contact their GP or their vaccination site and to get to be offered the vaccine. This is not an exclusion policy. The more people that are vaccinated, the better, and it will be as welcoming as it possibly can be.
Thank you. Back to you, Mike.
Thanks. So in the earlier presentation, we saw that great slide, and I'd love to send that around to everybody who's expressed an interest in this session, which is the JCVI slide, which showed the different tiers. There's certainly been some talk about potentially some review of who sits in those tiers. I know recently it was clarified that carers, unpaid carers, would sit within tier 6, and there's been certainly within the news, perhaps more so than than certainly nothing that's come locally from the CCG. But when might we see any sorts of changes, if we do see them, in terms of frontline key workers and that review of who would sit in there, whether it be pharmacy staff or teachers or what have you?
So do you want to start on this one? So I think it's really important to recognise that these priority cohorts are set nationally by the JVAC, the Joint Committee on Vaccination and Immunisation. I think, though, I think there will be a rethink or a pause after the 15th about what is the next group to do. I can't say when that's going to be, because obviously it's set nationally. I know people would have made representations to the committee. I know teachers, police have made those representations, which I know the committee will be considering. And of course, once the committee comes out and says these are the priority cohorts, these are the key workers, we will do that. But it's really important that we keep to the guidelines set to us nationally, because there is science behind the decisions that the committee make, as Patrick has said.
Just one reference there, Mike, you made to pharmacy staff. So pharmacy staff will sit in that patient-facing group. So pharmacy staff should be able to get vaccine now. The reason this is so important, if one area suddenly starts offering all its teachers, you can imagine that the area next to them are going to be immediately assisting on the same thing. Logistically, trying to deliver this program is really challenging on top of all the other work that's going on. So this isn't a question of piece of primary care networks stopping all the other general practice work and just to do the vaccination. They're carrying on doing that. So the more noise there is with variation from national protocols, the more difficult it is to actually deliver the programme, and the harder it is to give the best service that we can to the people who have been prioritised through the national programme. The ask on staff around this programme is huge. We have a tired workforce who've had a really difficult year, and we need them to be functioning as well as they.
Second.
Sorry,
Yes.
Not quite sure what the point at which you lost me there. I don't know why I muted. But yeah, so the key bit is that the staff have are able to direct their attention to the group in whom they are going to have most impact.
Thanks, Patrick. We mentioned carers there, and obviously carers have been sort of moved up into tier 6. So obviously somebody who provides care for a relative or a loved one who is unpaid for that, and for whom that person would struggle if they became ill, is now eligible for well, not yet eligible, but will be eligible sooner than they might have been otherwise based on their age. How do we make sure that carers are on the list and are invited for vaccinations? What do they need to do to make sure that they get their vaccines?
So that's a really good point. So the key message to the public to get out is, if you are a carer, that you need to check that your practice know that you're a carer. So we have registers in the practices of carers, but our suspicion is that they aren't comprehensive. We are trying to correlate our lists of carers with the lists of carers that the local authority hold as well. Obviously, there are the usual challenges of data protection around that, and we're making sure that we remain cognizant of the demands of that, because data has to be shared with in a way in line with the national recommendations. But essentially the message is to try to make sure that if you are a carer, that you are logged within your practice as a carer and identify who it is that you are caring for. Thank you.
Thanks, Patrick. Okay, Jude, do we have time for another?
I think just one quick one, probably.
Just one more. So, as well as people with interest and questions about the vaccination and how it works and so on, there was a huge amount of support that we've heard for the vaccination effort, and certainly some people, rather than asking about how the vaccines worked and so on, we're asking, how can I get involved? What can I do to help? So, what's our message, or what should our message be to people who want to get involved, whether it be as vaccinators or volunteers supporting the effort?
Is that something for Tonia?
So, I mean, again, I can start. I think, I think everyone who wants to support our vaccine effort, and it will be really important that we have people volunteering as we go forward, because remember, we are at the start of this vaccination programme, and the ambition is by autumn for everyone over the age of 18 to receive the vaccine. But we're coordinating our volunteering effort through rules, or through our CVS. So I think maybe that, I hate to burden you, Mike, but maybe one way would be to confirm that via email about the routes, and also your patient participation groups at your practices may also reach out and request people to come and support some of the primary care sites. So I would watch out for the approaches by practices, but if you are interested, I would register with rules, and they will contact you when volunteers are required.
Well, thank you all. That's probably all the time we have for questions, but I'd like to give all of our panel members the opportunity to sort of give you one message to take away that they think is really important from today. So could I start with Shannon?
Thank you very much, and thank you to my co-presenters as well for all the input that you've had. So I think if there's one message that I'd like to leave everybody with, is the fact that we've been through a long, hard struggle. It's been a year now since the pandemic hit. Finally, we've got those vaccines and they're going out. We know they're effective in protecting people from serious illness and potentially from death. Whilst we're still learning more about what else the vaccines can and can't do, it's absolutely essential that we all continue to follow the same rules as everyone else, even after being vaccinated. And that is to stay at home if possible, whether you've had a vaccine or not. And to remember, hands, face, space, because that will never get old. Thank you.
Thanks, Shannon. Tonia?
I'd just like to again thank everyone who's been so very, very excellent in both supporting the vaccine and coming forward. So, and I think the Mike's piece around the forbearance, we will get round to you. You will have your invite. It just takes us a while to get through the numbers, but thank you, and thank you. And I say thank you for your support. The staff really appreciate the kind words and feedback that they get. So that's great as well. Thank you.
Thanks. Patrick?
Yeah, just the vaccines are safe, they're well tolerated, they are significantly more effective than the flu vaccines that we've used over many years. The way in which they're made means that they are likely to be very safe. So all the messages really are that this is a good product to use. It will change the way we can live our lives. And the final thing really is just to thank the Richmond residents. The volunteers have been extraordinary in the PCN sites. We've had so much cake brought in by patients who are being vaccinated as well, that the next challenge for us is going to be organising weight management and exercise classes for all our staff. So thank you very much to the public. They've been fantastic.
Thank you, Patrick. Mike, a little roundup of what next and how we go, what's going to happen from here.
Thanks, Julie. So I think for me, first to thank our panel very much for their input. It's really valuable to be able to get these messages out and to be able to, to hopefully answer as many people's questions as we can. It was a real challenge because we had so many people that registered, and I mean, we could have spent a whole week on a video call answering each of those individual questions. So hopefully most of our audience will feel that we've covered the ground that was indicated in their questions. But I think it's really important to note that this isn't the only conversation. This isn't the only opportunity for people to come forward and ask their questions. Certainly, Healthwatch is here. We're happy to be contacted and to answer questions. If we don't have the answers, we will look into it and come back to you with questions. So please do give us a call, send us an email, come to us with your questions if you still have them, and we're very happy to help. I'd also like to just sort of note that the feedback we've had about the way the vaccination program's going from the community has been pretty much universally positive. It's a real privilege to see it, and that's not something that, as an organisation that reviews health and social care, that's not something that I always say. So you'll know that it's heartfelt when I say that it's been pretty much unanimously positive.
Thank you, Mike. Well, I'd like to thank all the panel members for sharing their expertise and knowledge so generously this afternoon with all of us. But I'd also like to thank the teams at Healthwatch, at the Clinical Commissioning Group and at Richmond Council, who worked so hard to put this event together. With nearly 500 people registered, or maybe over 500 people registering, it was no mean feat. But I'd like to reiterate Mike's comments about the comments that we've had for the whole process of the vaccination programme at all of the centres, where everybody has been absolutely overwhelmed by how well it went and how well welcomed they were. But I'd also like to thank all of you for your presence here today and for providing us with the searching questions that we've been able to put to the panel. Please do share all the information that you've received with your friends and family to help us to make the vaccination programme in Richmond a real success in fighting this dreadful virus. Thank you all very much, and good afternoon.